Hello, I'm Andy Reynolds, host of NCQA's Quality Matters podcast. I'm speaking today with Brad Hawkins, who is vice president at MRO. MRO is a thought leadership sponsor of NCQA's 2025 Health Innovation Summit. And I was curious to learn more about MRO's work to improve healthcare, and Brad was good enough to agree to speak with me. Brad, thank you for being here.
Thank you, Andy. We appreciate it. Long history of partnering with NCQA. Really enjoyed the conference this past year. So excited to have a quick conversation with you. Thanks for the time.
MRO is making a name for itself. It's thought leadership in digital quality. And so I'd like to focus on digital quality with you today. I'm curious about your work, I'd like to know about your impact and what you see coming in digital quality. So I'll start by asking you three questions. Your what, so what, and then now what. So let's start with the what. What does MRO do to improve digital quality care?
Yeah, great question, right? So I'm happy to kind of give you our purview onto the market. So MRO, for those who don't know, has been in the healthcare space and I'll say clinical data exchange for the past 24 years, right? Getting our start in what many people would call a health information handler, release of information, or the dreaded term copy service vendor, right? I need records from said provider. When I need those, I reach out to MRO, who's working on behalf of the provider to get those records, to the requester, be it a law firm, a life insurance requester, or in many cases, as you can imagine, with health plans looking to get data on risk adjustment or HEDIS and quality scores, et cetera. So trying to get the information. And I think we've been really working in this space in the provider payer collaboration space for the last 25 years. I think as we've seen a lot of these market conditions, I'll say moving, right? Like who moved my cheese? The need for us to align to sort of the changing, I'll say, forecast or, weather report on sort of how is data going to be exchanged? How is it going to be leveraged and utilized? And how can we play a more strategic role in making sure that when a health plan is asking for data, that they're getting the data elements and the information they need on their members, right? And so I think for us, our goal is really looking at this trust that we've built with providers, and I'll say a long history of experience working with health plans, payers looking for information. How can we do that in a more efficient and more strategic manner? I think why that's important, right? So that's the big kind of what are we doing? I think the why, or the so what, is as you look at the changing, I'll say, landscape and dynamic, right? And everybody knows the same stats. 10,000 Americans turn 65 till 2029. NCQA is pushing for all HEDIS measures to be digital by 2030. And I think we also are struggling because a lot of health plans are entering into more value-based care arrangements, right? Pushing for all of their members to be in some type of, at least in the Medicare Advantage population, to be in some type of value-based care partnership. All of that is going to be predicated upon our ability to share data. And I think what I'm really making, I'll say more than a bet, is I believe strongly that it's not just data that we've got to be solving for. I think that having been an old health information exchange salesperson, or RIOs or CHINs or LENS, as they call them in Canada, data exchange, right, has come a long way. We're still sending a lot of HL7 messages backwards and forwards. We've got a lot of promise of things like FHIR, but ultimately, what's really going to drive it is when we get all stakeholders to the table and say, Andy, what's the data you need from this provider? And we ensure that the data that we are feeding to you is exactly what you're needing to be measured on. Unless we do that, I think we have a lot of half measures, right? That we're not sending data that is, I'll say, holistic or standardized or crosswalked. And, a lot of the focus of NCQA and some of the work around the DAV program and primary source verification is to do just that, right? We want to validate that the data elements captured are truly the data elements documented. And so for us, it's really, I'll say that, the old term of like skating to where the puck's going to be is really pushing not only our own providers that we work on behalf of to say, hey, FYI, right, there's a light at the end of the tunnel and, it could be a train. is that we also have to be looking at, how are we arming you to be ready for that 2030, digital measure push from NCQA health plan? How are you being, how are you aligning to ensure that you can get not just a portion of your membership, but you're really getting all of your members' data, right? So really trying to, I'll say, drive or push, these separate organizations to a more collaborative approach, moving forward. And I think coming out of NCQA, uh, and just hearing a lot of the peer-to-peer conversations and hallway conversations, I think that maybe in the past there was a little bit of we know that it's a destination we want to get to. I think there was more discussion this year than ever before around how do we do it, right? Really tangible, tactical, right? We can't always be putting up mission statements and strategy, but really talking through the tactics of how we go do this work. And I think that's what was really encouraging to me. So I think the now what is, okay, let's not lose that momentum. Let's kind of continue to press on the accelerator and see if we can start to showcase that, right? And to be able to go back to NCQA next year and say, look at what was accomplished based off having the bold strategy and tactics to take the step forward and actually did go do the work.
Well, I admire your ambition, and I'm glad to hear that you felt like the industry conversations have shifted into more practical, how do we do things? That's an encouraging step forward from the old days of, well, should we even go in this digital direction?
Mm-hmm.
And I appreciate your pointing out that you've been in the data business for a long time. I'm curious, drilling down into more of the so what or the impact. What do you see there, or how do you know that you're improving quality, or what steps do you see in the digital space that is improving quality?
Well, I think if you look at the approach, right? Like, so if I go to a health plan today and say, are you getting, let's call it HEDIS supplemental data feeds, or do you get data feeds from any providers? There is upteen number of solutions, vendors, similar to 2008 when there was 580 million for, put into the market for health information exchange. Anybody who had ever sent an HL7 message had became an became an HIE vendor overnight, right? I think as we sort of look at driving digital quality, it's not enough to just do a data feed, right? It's really trying to outline and uncover where do we have data integrity or quality issues, right? So really going in and saying, okay, why are there so many, I'll say, perceived and actual data quality issues? And the so what is because every provider documents differently than the other. Even if I'm on flavor A of an HIE, that's the same as, this other provider. I might document certain things in different areas, right? So I've got sort of that freedom as a provider. And if we set up a data feed that's not capturing that data element, then guess what, right? You as a payer aren't receiving it. And you're assuming that it's not being documented when in reality, that provider is doing that work. It's just you're not seeing it in the data feed they're providing. That creates a lot of that abrasion that we need to remove. And so I think that the so what and the impact is when you truly sit down and say, what are those data elements that are important for you to capture, critical for you to capture? How do we map that back to the EHR when we're setting up those integrations and those data feeds and doing that crosswalk? I think not only does it lead to what you're hopefully wanting, right? I want increased yield on those data elements. I want to increase my star ratings. I want to get higher quality scores. But more importantly, when we measure it, right? What is it? If I can't inspect it, I can't respect it. When we're able to actually do the work to understand, look, I see practice A has not been documenting hemoglobin A1Cs, or we're missing BPs or BMIs. What that opens up to, right, is more of that collaborative discussion of going back to the provider and say, something's amiss, right? And giving you as a health plan visibility into not being seen as just another voice at the provider telling them they didn't do this right or do that wrong. It's sort of looking at, hey, how do we help you give us the data elements we're looking at? We've been seeing this sort of dramatic decrease over time, and we're not getting those data elements that we need. So what I will tell you, the so what is outside of the measuring stick of stars and all of the components that are important there. I think it's really leading to more of a collaborative agreement between the health plan and the provider, because we're looking to give you credit for all of the work you're doing to treat my members and to treat that population. And if we're not looking at, okay, did you document it? Did we capture it? Ultimately, we're sort of flying blind a little bit. And I think even more importantly, Andy, to this, sorry to kind of continue to pontificate on it, as a failed athlete, I always appreciated, right, at least knowing what the score was throughout the entire game. I talked to far too many health plans that when it comes to HEDIS and kind of this concept of, oh, it's HEDIS season, right? And I think we're seeing a dramatic change to more of, no, I need to have all year long visibility into my encounters, into the quality scores. At least I know that I'm behind or I'm ahead. Because if I don't get all of the data till March or February or January, and I see that I'm missing a bunch of the data, guess what? It's too late to go course correct, right? And we have to go do it for the next year. But if I'm getting that information readily available earlier in the year, I'm getting a chance to, kind of measure my practices and my providers and understand how are they doing from a data capture standpoint. It gives us an opportunity to impact change. And I have to believe that if we're driving higher star quality scores, that we're driving better care, right? That's the whole goal.
Right. Sure. Well, you've outlined for us a strong what. I appreciate how you have phrased your so what, or quantifying, framing your impact. I wonder if you could look ahead for us and tell us more about what do you recommend quality advocates know, or what should they do these days about digital quality? In other words, what's the now what for people who might be watching us, Brad?
Well, I know what I'm doing, right? Like I know that in the conversations I have with health plans and the ones we serve today, it's really working with them collaboratively with an existing provider network that MRO is working with over 2,000 hospitals and 35,000 practices, and educating both sides of the fence, Andy, of letting them know, say, look, the world of HEDIS as you know it is changing. It's not going away, it's just changing, and we need to change with it. And so let's align to ensuring that we're, let's say the word again, collaborating with the health plans that we're in partnership with. Let's start to identify the data elements they're looking for. Let's start to map that back to your EHR. Let's start to put those sort of the lighthouse on the hill that we can point to say they've got success. Right now, that's what we're starving for is really organizations that are got the forethought to say, let's go do it, right? We're not going to get it perfect, but we're going to learn. And if we can do that, then that's great. And so really it's not a hurry up and wait. I think, people always kind of question like, well, 2030 is pretty far down the road. And I think if I look at it, I'm going to have like a sophomore or junior in college by 2030. So that feels like years, like decades away, but it's not. And I think for me is really kind of like, let's take the bull by the horns. Let's start to really push this and be intentional and deliberate about engaging health plans, engaging providers, and saying, let's go do this work so we can start to get a better measurement. And I think the response so far has been really positive. I would say a year ago, like I said, there would be a lot of, I'm not sure why I would do that or how do I do that? But I think we've been able to, map out a path and a success plan with both parties where they're both feeling like this is a collaborative approach. If we can establish sort of these, I'll say more of a streaming of quality data, right? Like where I'm actually sending information on Andy as Andy has encounters. So like you, health plan, have been kept in the loop on any and all, encounters that you've had or any interactions you've had with a provider that's going to be valuable for you to know.
Right. Well, Brad Hawkins of MRO, I see we're out of time, so I want to thank you for speaking with me, and thank you for your support of digital quality improvement, and thank you for helping make happen the 2025 Health Innovation Summit. We appreciate your help.
Thank you, Andy. Appreciate the time. Have a great day.
You too.